Too often, Black women are a mere afterthought in conversations around wellness, but not in this space. On this podcast, the dialogue is always centered around women like you. Welcome to the podcast, but more importantly, welcome to the tribe. Be well, sis. All right, so today I have Dr. Candice Nicole with us. She is so many things that I already talked to you guys about in the intro, but I'm super excited to talk to you specifically about your journey with uterine fibroids, because so many of us have them and we suffer in silence. This is our normal. But before we get there, how are you doing today? Thank you so much for being here with me.
First, thank you for having me and doing the good work that you're doing with the Be Well Sis podcast. I'm excited to talk to you today. I'm doing well.
Thank you. Good. So let's just jump into it. So I was just reading the statistics about uterine fibroids, and it says that about 6% of white women have uterine fibroids, but about 25% of Black women between the ages of 18 and 30 have them. By age 35, that number increases to 60% of Black women. So let's talk about your journey, your diagnosis, and all of that good stuff. Not good stuff, but all of that.
Right. Well, good stuff emerged at the end. I didn't know that the disparity was that wide. I didn't realize white women were at 6% to our 25 to 60%. That's wild.
Yep.
And what it suggests to me is that the priority around research for women's health in general, but Black women's health in particular, things that disproportionately impact us, needs more funding.
Yep.
So let me just start there.
Yep.
And it was, for me, the experience being a sex researcher and watching my reproductive health affect my sexual health was so mind-blowing and like heartbreaking for me for so long, because I didn't imagine it would be that way. I've largely had a good sex life from my sexual debut at 14 right on till around 25, 26. And then I went to my gynecologist appointment, and she was like, I'm starting to see some distortion in the shape of your uterus. Okay. It looks like you might have some fibroids, like when she was pressing and doing a pelvic exam. And I was like, oh, well, what do I do about that? Because it wasn't symptomatic at the time. Mm-hmm. And she was like, we're just going to take a wait and see approach. But that wait and see approach wasn't guided by, here's information on how Black women's fibroid experiences are disproportionate, more severe, more likely to be symptomatic. None of that. It was just, we'll wait and see.
Yep.
And so I trusted that at the time because that's all I knew. And I wasn't having symptoms until within the next year and a half, at which point, and this is probably going to be familiar to anybody who has fibroids, especially fibroids that grow in size. Mm-hmm. And maybe it was a stress of grad school, who knows? Sure. But, sure. Stressors can exacerbate your symptoms. And so my cycles became heavier, and several accidents, like more than I can count on both hands, where I was embarrassed and having leakage and things like that, and having to navigate that as I'm developing my professional identity and trying to figure out what's going on with my health as a person who researches this. And it felt like, okay, since I'm a researcher, I have some autonomy, I have some literacy, I can look into all of the things that I can do for myself. And so I took that approach, and I looked at all of the alternative methods, like tried acupressure, acupuncture, herbs, meditation, like things that were not surgical at first. Mm-hmm. And finally, I was talking to my doctor about the symptoms, but it didn't seem like it was connecting. So I graduated from my degree program. I started as a assistant professor, and I'm thinking that the way that I communicate should be effective. Like you should get that I know what I'm talking about.
Yep.
And there was this condescending tone from my healthcare provider at the time, like, well, you're just going to have to figure it out. Like, I don't know what to tell you. It's hard, either you're going to have this, you can have this major surgery. You can try these, like less invasive surgical options, but some people just have more severe symptoms than others. And I'm like, it's not just some people, it's Black women in particular.
Right.
And I was talking to my then partner, now husband, about like what I was going through. And he was there with me, supportive and patient throughout the journey, because eventually it started to impact my sex life. So if you have increased bleeding, I'm trying different contraception and nothing's working to reduce the bleeding. And that means I'm incredibly fatigued because now I have anemia.
Yep.
Like all of these things were happening and I'm communicating and they're like, well, just take some Geritol.
Right.
The Geritol did help now with my iron levels, but it didn't help with the actual problem.
Right.
So eventually I was like, I'm going to try these surgeries. And I tried 2 non-invasive surgeries. Like, there's a specific name for it, but basically you don't have to make incisions in the body. You can go in laparoscopically.
Mm-hmm.
And I tried both of those and they were ineffective. Mm-hmm. And so I was hopeful both times and nothing came of it. And my frustration continued to grow. So my partner and I got married, and throughout the first 2.5 years of our marriage, we were really unable to have the type of sex that I wanted and that he wanted, because we were always navigating around my menstruation and my symptoms with the fibroids.
Yeah.
At a certain point, I was like, okay, if I have to have the open myomectomy, I'm going to do what I have to do. Yeah. And it was at that point where my doctor was like, see, I told you. As opposed to like, I understand why you want to try all of these other options first. And so no compassion.
Right.
But what I can say is when I had the open myomectomy and he was able to go in, he saw the actual problems that the fibroids were in my uterine cavity. And so I would have never been able to conceive had I not had the fibroids removed surgically.
Yeah.
And I thought I was in the clear. So I was like, okay, I've had the fibroids removed. Within 6 months of that surgery, I conceived my son. And then I was, like new mommy tired, through that normal tired, but not the type of fatigue I had experienced before when I was anemic. And so I was feeling hopeful.
Yeah.
But the scar tissue from those surgeries, the laparoscopic and the open surgeries, was not like, the side effects of that weren't communicated to me. And so I had adhesions in my abdomen to the front walls of the uterine. I didn't know all of these things until my Black woman OBGYN who delivered my son, once she did the C-section, she was like, oh my goodness. Like there's so much scar tissue in here. She's like, I'm gonna hook you up though, girl. So she did her best to, help me recover. But within 1.5 years, I had an ectopic pregnancy. So what an ectopic pregnancy is. And basically because of the scar tissue, the egg implanted outside of my uterus and it was on my fallopian tube. And like 1% to 2% of people who experience ectopic pregnancy, I had a fallopian tube rupture, which is a medical crisis.
Right.
And the healthcare professionals who were the emergency medical staff who came to my house that my husband called did not touch me. So they watched me on my bed as I lay there bleeding out internally, which I didn't know. I just knew I wasn't well and I needed help, but I was in and out of consciousness. My husband is terrified at this point, and my toddler is in the room sleeping. So we're trying to figure out what's going on. They didn't take my vitals, which is a normal thing to do. They were trying to orient me towards time and like place. And I was in and out of consciousness, so I couldn't answer the questions. And my hypothesis is that because I live in Kentucky, where there's an increased rate of like opioid overdose and things like that, they probably assumed I was on drugs or something like that. But still, they had an option to treat me.
Yes. And at minimum, take your vitals. What are they there for? Just looking at you?
That's what they were. Three white men standing in my bedroom looking at me is what I recall before I, passed out again. And my husband ended up being the person to run me outside. He was like, if you don't grab her, I'm going to take her in the car myself.
Jesus.
And so he had to run me outside. And then when he got down the stairs, they were like, no, just put her in the gurney. So the fact that he had to be the one to put me in the gurney, not them, was already a problem. But luckily, when I got to the hospital, I had, they gave me the IV. And so I was able to regain consciousness. And the doctor on staff, the attending, was like, are you pregnant? I was like, no, I just had a cycle a month ago. And she was like, no, we're going to test anyway. And she was able to confirm that I had been pregnant and so they were like, you need to go into emergency surgery.
Mm-hmm.
And everybody, because they found out I was Dr. Candice as opposed to
Right.
Candice,
Right.
who should have been treated equally.
Right.
They stepped up their health provision.
Mm-hmm.
And I'm so grateful that my life was spared. I had 6 units of blood to recover. You know, I was on the brink. And it was just one of those terrifying experiences that after you have it, you have to recalibrate your idea of yourself in general.
Yeah. For sure.
And that's what happened in my sex life. So I'm going to pause because that's a long story and there's so many components to it. But after that, for even that whole summer, it was a sexless summer because I was terrified of having sex again. And I had to tap into my own training as a researcher and a therapist with my Black woman mental health provider to come back to my sexual self after that.
Oh, wow. There's so much to unpack there. First of all, as you retell this story, how are you feeling? Because I can imagine reliving some of it. I
feel 2 things. One is grateful that I'm here to tell the story.
Yeah.
And the second is frustrated that the healthcare system continues to interact with Black women in this way.
Yes.
And that I shouldn't have to broker my intellectual or academic privilege to be treated like a human being.
Yes. Yep. Mm-hmm. That is so, I so can identify with you because I never lead with what I do, what I know. But whenever I'm in that space, especially with my children, I always have to share my credentials. And I hate that so much.
It's like you have to.
Right. And I feel that just because I may know more or whatever, or I know as much as you do, does not make my life, my time, my health more important than somebody else. And that's what I always think about. So now if I'm not presenting myself as Dr. Dunbar, does that mean that I just lay here or my kids do not receive the proper care or my mother doesn't receive the proper care? So all of those things, there's so many layers to it. There's so much that needs to be changed. But I want to go back before I go off on a long tangent.
No, because it's real, because we could go there.
Yes, we can. It could be a whole mini series. But I want to touch on the other things that you've tried before you decided to have the myomectomy. So did you find that the herbs that you were taking or the acupuncture, was that even minimally helpful at all? With the symptoms?
I'm not sure if it was placebo effect or if there was some reduction in symptoms. I just felt better that I was able to try something. And I tried it for 3 months. It was, Chinese medicine, the herbs that they give you and the acupuncture. And I felt better. I felt more energized.
Okay.
I didn't necessarily see a difference in the amount of bleeding or the length of the periods. But I felt better because I was trying, I think.
Okay. Gotcha. And for those who are not sure about fibroids and some possible symptoms, what were you experiencing? So you mentioned the bleeding and just discomfort during sex, right?
Yeah.
How long were your periods about? How many days would you say?
So my typical normal periods before the fibroids was 3 to 4 days. And not very heavy, just a normal amount. If you think about tampons, like a green tampon. And then, a yellow or a green tampon, depending on the day. By the time the symptoms were at their worst, I was changing less than once an hour. And it was full to capacity, with tampon and pad. So that level of extreme. And it's sometimes I couldn't catch it. So if I'm in a session for an hour with clients, or if I had in a class for 2.5 hours during my training program, so many embarrassing moments that I had to prepare in advance for the embarrassing moments and be thinking about, how to take care of myself in those situations.
Yeah. So full transparency, I also have fibroids. And a few semesters ago, I teach at a nursing school. And so for the majority of my class, it's women. And I remember I had just changed. And at this point, I'm wearing like they make like they're not eco-friendly, but right now is what I gotta do. They're
Yeah.
like diapers essentially.
Yes. I know exactly what you're
So
talking about.
I'm like, I know I'm going to be in class for a while. So right before I left my house, I just put on a diaper essentially, right? I'm like, this should be fine. So I go to class and the students were giving a presentation. So then when they were done, so I was sitting for a while as I watched, observed. Then I get up to go to the board and I feel warmth and I'm like,
Yes.
oh
That
my
flush
God,
feeling.
yes. I look down and I was wearing black pants, but I could see that in that region, it was like darker. I'm like, guys, I'm so sorry. I'm like, y'all, I just bled through. I'm just like, they're like, oh, it's okay. I'm like, they're offering tampons. And I'm like, no, I'm beyond that. I need to go home.
Yeah.
I'm like, I'm so sorry, but we're going to have to end session a little bit earlier than we normally would have. And I'm grateful that it was a class full of women. We're in the profession of like helping and all those things, but the embarrassment is real.
Yes. Yes. And it's like that. So when you describe that standing, the fear of standing up, like the anxiety that I imagine you would feel like every time you're on your cycle and anytime you go somewhere, you stand up slowly.
Yes.
And you're like,
yes,
what is happening?
Yes. Oh my goodness. And let's talk about the sex part. For me, what you mentioned earlier, navigating having sex around the menstrual cycle, depending on how heavy it is. Sometimes I'm really, really tired. Even if you're just like, well, let's, whatever on the cycle. I'm just like, I'm like drained. And I just don't necessarily feel all that sexy if I feel like, it's like a crime scene. Yeah.
Absolutely. And so that resonating totally with everything you're saying, because it was like, if the length of the period and the amount of period is happening longer. So now sometimes periods are a week or a week and a half. And at their worst, I had a summer long like spotting situation because I was trying different contraceptions and they weren't working. So they weren't allowing me to have a cycle. And so sometimes, you might say, okay, I'm willing to have sex on my period, but then cleanup and then, embarrassment. At the time, I would feel differently now, but that's where I was at that time. It's like embarrassment, cleanup, like the extra steps that go into that, but really not having the desire. Like my desire, which I would say is probably above average for most women, dropped to the floor because of the fatigue and the frustration and just not having the type of sex that I was used to having anymore, having to navigate everything that was going on in my body.
Yeah. And listening to your story, what frustrated me was the fact that the providers would just be like, well, it is what it is. You have fibroids, but not realizing, even though it's not, quote, life-threatening, it changes
Quality
everything.
of life is different.
Exactly. Quality like plummets. And that's also important. So, okay, great, you're here, but like all the things that made you happy to be here are impacted by this. And especially if you've been with your partner for a while and now there's a dramatic shift in how you are sexually, that might cause like a little bit of friction between you two.
Yeah.
So did you find that there was any impact in your relationship while you were navigating?
Absolutely. I can say that there were two different time points. So I'm thinking pre the surgery and then post the ectopic pregnancy. So pre the fibroid surgery, when things were really rough, I would say if I could rate my husband's patience, it was at 100. But my sense of sexual self felt so compromised that my desire was so low. It's like he was having way more opportunities to be patient than I wish he would have had to have, 'cause I was just like, I don't know, like, I don't feel good about like where I'm at, and my body felt like it was betraying me. And so it just didn't feel like I wanted to. And then if you don't want to, it feels obligatory. And a partner can sense when you're like, I'll do it for you, but it's not going to work for me. It's not going to be that great for me. And then after the ectopic pregnancy, just the trauma of that experience was like, I feel afraid to have sex right now. Like I'm afraid that if I do, something else like this could happen. And so I really had to work with my own therapist around that and it's just been recently in the past few months, like after that was 2021. So this is 2023, where all of the things that I know as a sex researcher and all of the things that I got a chance to discuss with a good Black woman therapist came back together because I had been able to reduce the experience of trauma in my body. And so, like, you know how you hold a traumatic experience with you, even if mentally you're prepared to like talk about it and process it. It was like, okay, my body is now ready to come back on board.
Yeah.
But I had practiced so many things, and I'm happy to talk about all of the steps I took to get back there.
Yes, for sure. And I'm happy you mentioned the trauma part, because my theory, which really isn't rooted in anything per se, but just like what I keep hearing, I feel that Black women, we hold our trauma in our wombs. I feel like it like manifests into fibroids and then our pregnancy complications and all of those things. I just think that we just, for whatever reason, it just goes there. I don't know.
No, I feel you. I mean, we have a history of sexual terrorism in this country and reproductive experimentation. And so I could see why. I could understand from a compassionate place, which is one of the things I had to learn, why my womb would respond the way it responded to this world that we live in. And holding that compassion for that part of myself was a part of how I healed.
Yeah. So in what ways, what are some tangible ways that you hold compassion for yourself?
So in my yoga and meditation practice, a part of it is placing a hand on my womb and placing a hand on my heart and affirming those parts of my body, like thanking them for being present, forgiving my body for the ways that I've been experiencing harm and distress with it, and holding space for, I know the world that I'm living in and the world that my mothers lived in who have fibroids and my grandmothers lived in who have fibroids was so toxic to us that you would resist in this way. Like you might not want, the womb space to be able to hold anything after generations have had all of that.
Yeah.
And making that known to my body, like, the way I touch and hold my body made a big difference. I would also say that the conversations my husband and I had about what sex is and what sex can be became a lot deeper. And that was liberating in and of itself, because most of the time when we think about sex, we think about intercourse or penetration. And there's so many things sex can be that are not intercourse and penetration. And I know that intellectually, right? I know about oral sex and digital sex and like just phone sex and text sex and all of these things that we have options for. And I was like, oh, when I got married, it's like it's supposed to just be this and that. And so that limited view of what sex can be got in the way. And I was like, okay, babe, here are the things that I like. Here are all the ways that we can enjoy it. And what are the things that you like? What are all the things that we can enjoy? And we really just got down with, it can be more than this. Maybe we like oral sex and there are certain times that if I'm experiencing pain, that we choose that option instead because penetration would be painful, or if we just naming that those were available to us, he was like, oh yeah, I'm down for that. Like, and for people who are still dealing with the symptoms of fibroids, it's like, well, maybe intercourse isn't what you do. Maybe that's off the table and other things are on the table. Yeah. And so thinking about having an expanded view of sex made a huge difference.
Yeah, for sure. I feel like I know you because I feel like our experiences are very similar. When you mentioned forgiving yourself, I realized it took me some time to realize that I had to forgive my body too. I didn't realize I was mad at my body. I had a traumatic birth with my 4-year-old. Pregnancy was completely, benign. And then essentially my body just like kicked him out way too soon. So we had placental abruption. So the placenta detached too soon.
Yeah.
He's fine now, thank God. But I was so mad at my body. I'm just like, you failed us and you could have killed us. That I did not realize that I was so mad at my body. It took me maybe
furious.
And I was like resentful to me. And I think it took maybe at least 2 years for me to actually realize and process that and then forgive my body. And same with you, like to embrace and thank my body for dealing in this toxic space and also being there for us.
Yes.
You know, like things didn't go perfectly, but you still maintained us. And yeah. And then I'm thinking about the sexual piece too. My husband and I have been together for like 14 years now, and we've had to have more conversations about what is sex? What does it look like for us? You know, we are no longer at like young 20-year-olds. Like we're in our 30s, pushing, you know, knocking on 40's door. Things look different.
I just hit 40's door in January, so I feel you.
Happy birthday. You look great.
Thank you.
So just how things change and we evolve. And I think for me, I was used to doing things a certain way, and that was our norm. And that's fine. But like, I don't want just fine. I want great. Yeah. So
and
how did
being
you
used to you doing it a certain way. And I had such good sex throughout my life that I took it for granted. And it helped me to have more empathy with the clients I work with. With the research I do, I can ask better questions now about like what gets in the way of good sex is one of my primary research questions. And I know that there's a wider spectrum based on going through this experience.
Yeah. So actually I want to ask you, so what are you seeing that mostly impacts people's sex lives? So what does get in the way of good sex?
Yeah. So I like to look at it from a systems perspective. I think there are some people doing really good work looking at it biologically, and that's not my lane. So I'm going to let them be in it. Right. And I do what it looks like interpersonally in the romantic dyad and what it looks like socially or structurally. So I think from the systems and structures level, everything that we just talked about with the medical profession is what gets in the way of good sex, right?
Yep.
Medical providers not being trained to be culturally responsive and intentional with their work, especially how they talk to Black women. And there not being enough sex ed for medical professionals. So they just don't even understand. They get a little bit on reproduction and not enough on sex ed. You know that as a person in that field, right? Same for me as a psychologist. Like I had to find the sex ed classes. They were not a part of my program of study. So healthcare providers not being trained well. But then we're also talking about gendered racism for Black women. So one of the things that I look at in my work is how these systems of oppression impact good sex. And for Black women like me, and this is my story and maybe other people's story, my commute to work is a function of residential segregation and a function of my class privilege and a function of wanting to live in an area that has more Black people than the place where I work. Right. So I drive an hour to work, an hour and some change to work. You think about how much time that takes in a day, whereas Black women's commutes are typically longer than other women's commutes. That's what our science shows. But also the types of jobs that Black women work are more distressing than the jobs that other women work. And the tasks that we're asked to do, even if we have the same job description, are more severe and harsh on our bodies and minds and emotions than what other women are asked to do. And so when we use that term mule of the world, if capitalism, racism, and sexism are intersecting to impact even professional Black women's work lives, it's not just a matter of prioritizing good sex. It really is us thinking about these systems of oppression that are messing it up. So those are some of the things that get in the way.
Yeah.
And then got the nerve to underpay us, girl.
Listen. So just thinking about the commute. So you take at least an hour to get to work. You get to work, you do the jobs, you do extra jobs on top of the job that you were hired for. You're doing the emotional labor of the team. Okay. Then you go home, you mother, you wife, you do whatever housekeeping. You are spent. At least I am spent. I'm not like, I honestly am not thinking about sex. And one of the things that I've had to talk to my husband about is I'm like, babe, me and you are different in the sense that you ready. I need to.
He's got that spontaneous desire.
Right. And I
and you
do
have
not.
responsive desire. You need some
Exactly.
time.
Exactly.
Yes.
Build up. So send me something sexy. Like, tell me I'm beautiful. Clean the house. Like, get
The
me.
cleaning, the chore play is it for me.
Listen, ain't nothing sexier than when he's like building something, vacuuming,
You get in
raising
the
the
house and it's
children.
smelling good and looking good. Don't let there be
Listen,
some dinner. What
what?
is
Come get
this?
it. Like,
Yes.
for sure. So just, and I think about how throughout the course of our relationship, sex looks different because our responsibilities are different. We had so much time to do nothing
So
but
much
have the
time.
sex before. Now it's like we got children, other
People responsibilities.
right. So it definitely changes things. But
And a lot of the sex researchers that I read, and most of them, unfortunately, are predominantly white people, are like, you got to prioritize. And these are smart points. Like, you got to schedule sex, and these are important points. But if you don't think about the context of a Black woman's life and what she's contending with, some of us are the first in our family to have financial means, and that means we're responsible for other parts of our family that don't live with us, or we have multi-generational households. We've got these extra commutes. We get paid less. We have all of these things. You got to name it. Or else you can't address it.
Yep, for sure. Oh, so good. So tell me more about your journey coming into yourself. So you mentioned spending time with your therapist in order to reconcile what you know in your mind and in your body.
Right. That's key, because I'm a psychologist. I strongly believe in mental health for everyone, but it's important to know that it does not happen overnight, even if I know all of the clinical things, right? So insight and education do not include behavior change. Behavior change is its own different thing. And the things that we discussed with, like, forgiving yourself, giving yourself grace, having compassion, loving, getting back to love your body, all of those were things that I discussed in practice. My meditation and healing practice included, like, doing some stretches with my body. So the yoga poses for relaxation that I chose, yoga poses for pleasure that I chose, the things that help me stretch my womb area and my abdomen back out. Just like, because there was so much tension and tightness based on the adhesions and such like that. But I would say one of the foundational things for me related to approaching, how do I say it? Approaching sex from a place of curiosity again. And to do that, I had to approach other things from that place of curiosity. So I'm a researcher. I'm always curious. That's like my mindset. But I had started to take there's a problem to be solved approach to sex, as opposed to, what does this mean? Let me be curious about this. What other options are available if this problem never gets solved? Being open-minded about it, as opposed to, like, there's a problem, I can solve it, I can handle it. And so I thought about all of the things that I fear, the things that really scare me, things I want to do. And I was like, oh, this gave me an opportunity to live again and to live differently. So what are some things I've always wanted to do and I learned how to swim. So I love that. That was one of my big things. I was like, I have never learned how to swim, been terrified of water. The ocean is beautiful. The beach is beautiful, but I'm going to stay on the sand. And I was like, I almost died. What I'm going to do is reclaim all of those things that used to scare me. But that courage translated into my sex life too. I was like, okay, let me reclaim my sexual self once again, because one, I don't want to be a hypocrite out here researching and talking about good sex and not able to experience it for myself, because we deserve. But also I was like, let me release fear in all areas of my life. Let me choose courage in all areas of my life. And I have to practice that in tons of ways. So asking for what I want explicitly with my partner and with people who are not my partner, like, hey, this is the boundary that I have, or this is what I need, because I was socialized not to do that as a Black girl and Black woman. That was more vulnerable than just doing it myself, to ask for what I needed and what I wanted. And so that was a fear thing I got over. Learning to swim, learning to float. That was a fear thing that I got over. Investing in the things that matter to me, as opposed to all of the overwork and things like that. Like all of these components. So I signed up, or I applied for a sabbatical at work. It was like all of these pieces the things I've been afraid to do or the things I've put off because of capitalism and patriarchy and my own internalized depression, I'm about to ask for everything I want and need.
I love that. I love that so much. And you made such a really good point in how it's vulnerable. There's some vulnerability involved in asking. Yes. And my goodness, like a light bulb just went off. That makes
I tell my students all the time, or like my mentees, it's more vulnerable for you to ask for what you need than pretend you don't have needs.
Yeah.
And I was like, and I understand why you would pretend. Yeah. Because I've been there.
Yeah.
So suppressing my own needs or pretending like, I'll get through it. I'm strong. It's like, no, I have a request here, and they get to consent to offer that to me or not. Right. But I need to be vulnerable enough to make the request.
Oh, that is powerful. So powerful. What I like is that your curiosity kind of reminds me of something that I'm trying to implement in my life. And also I want the listeners to kind of explore too, is just reimagining things. Because we are very much in this system of capitalism, white supremacy, patriarchy, sexism, all the things, right, stacked against us. And one of the things I was saying earlier was that I feel that for me, like I do all the work, right? So I see my therapist, and whatever homework she gives me, I really do my best to do it. I'm really trying to grow. But then the outside forces, there's always something new to heal from, right? Mm-hmm. So I'm trying to figure out how to reimagine. I'm here, right? So how can I reimagine a different way of living? And I think that kind of goes into like liberation.
It does.
So talk to me more about liberation, because I am very new to the concept of what that means. So what does it mean to be just liberated sexually and otherwise?
Yeah. For me, it means that you have the autonomy to choose the type of consensual sex life that works well for you. So sexual liberation could mean an intentional choice of abstinence, not one that's imposed on you from, a religious norm or like an idea of yourself as good if you're abstaining. Mm-hmm. You can choose that. It can also mean you choose to have healthy sexual engagements with multiple people in different ways. You can choose different relationship structures. You can choose different, that's what sexual liberation means to me, that we have agency, that everybody gets to decide what's good for them as long as it's consensual and agentic. Like you get to make that choice, and that there shouldn't be this shaming either way. Like you're not sexual enough or you're too sexual.
Right.
That's what the liberation piece means for me. And that's what I try to help people approach when I think about my work, when I think about my personal practice. I'm like, what do I need to get free from? What are some things that I'm still dealing with that I've internalized that I thought were normal that actually do not serve me well? And so a lot of the things that I talk about for myself are elitism, like feeling like I got to be the best, not just good, but the best, wanting to go to the best schools and do the best, and win all of the awards and do it earliest and youngest and all of these things. That's an incredible amount of pressure and stress.
Yeah.
And so I understand the benefits that taking that approach afforded me, but at what cost?
Yeah. That's that part. What you just said there reminded me of a tweet that I just saw, and she said, as I healed, I became less ambitious. And that hit home because I started to judge myself. Cause I'm just like, I'm okay where I am. Cause normally in my mindset, I was raised to the next accomplishment, the next thing, the next thing. And I was just like, for what? I'm okay here. Like, my children are happy. I'm trying to keep them happy and healthy and whole, and we're okay. I don't need the next thing. And then I was like, started to judge myself, like maybe I'm getting lazy or whatever. But I'm just like, maybe like
you're like, you're clearly not lazy. And if you needed time to be lazy, okay,
right, that part too. I think so many of us spend time, or not that we spend time, it's just that so much noise. Like we've been fed all these ideas of what it looks like to be successful, to be a good woman, a good Black woman, to carry our families on our shoulders. And it just never stops. And I was looking at statistics about how even women who have, attained terminal degrees and, live in the great neighborhoods and are making this much money are still dying pretty early compared to our white counterparts who may not have, quote, achieved, right? And it's like, so for what? Like, for what? And then I've seen too many women die in their 50s, not even at the age of retirement yet. And they were putting off living life until they retire. We can't do that anymore.
No, we're going to live now.
Period.
Okay, we're going to live now. That was one of the lessons that I learned from being that close to death. It's like, I'm going to choose to live now. And I'm still every single day divesting from that overwork.
Yeah.
I have too much on my plate right now, and I'm trying to decide, what can I say no to? What can I say, I can't do this anymore? I'm still working on that every single day. So I don't want to make it sound like I'm just, the tables have turned. Is it still a practice? Because there are some things I really love to do, and it's hard for me to say no to things I enjoy doing. But there are some things that I need to do. And that's how I just take good care of myself. And if I'm not doing those, the way I show up and the stuff I want to do ain't even where I want it to be.
Truly, really and truly. Oh, thank you so much. Before we wrap up, I know you are the host of 2 podcasts. So please tell the people your podcast and where they can listen.
Yes, my podcasts are called How to Love a Human, where I talk to people with multiple marginalized identities about what the world would be like if it loved them. And I have another podcast called FTS. It's Fuck the System, a sexual liberation podcast, where I talk to people about how to experience good sex and how to understand those systems of oppression that get in the way of it. So both of those, you can find me on YouTube at Dr. Candice, Candice Nicole. And you can hit me up on Instagram. I'm on IG regularly sharing information about sexual wellness, sexual liberation, good sex, my research, and all of those things. And excitedly, I just signed my first book deal. So I can't wait to share, folks. If you want to join my community, I'll be updating you about that journey as I write and learn the process of being an author.
Oh, that is amazing. Congratulations.
Thank you.
I will put all those links down below in the show notes. That way you can click to follow and to listen to the podcast as well. That is exciting. I'm so happy for you. Yes.
I'm excited. That was like one of my childhood dreams. So I'm so grateful.
Oh, I love it. I love it. Oh, I just love seeing people get their things, like all the things that they came here for. They're getting it. I love it. So I'm super happy for you. I'm excited for the book. You got to come back when the book is done.
I will. Okay.
I will. Thank you. Thank you so much.
Thank you.